So Medicare doesn't cover long-term care. It says so right here in the Medicare New Handbook and on Medicare.gov. Sorry. But wait, Medicare Part A does pay for skilled nursing home, but not all the time. And unfortunately, usually these rules and guidelines and how Medicare would cover skilled nursing home is not properly explained or addressed, especially when you're in the hospital. In fact, Miss Leyanna of Delaware, who is no longer with us, sparked a class action lawsuit suing Medicare Part A because she spent her entire life savings on nursing home care that should have been covered under Medicare Part A, but unfortunately, due to one of the many holes in Medicare, wasn't. So then let us discuss Medicare Part A and how it covers skilled nursing care in this video. Alright, first I'd like to say if you understand Medicare Part A and how it works completely for skilled nursing care, you can skip toward the end of the video where I talk about possible solutions. But for those of you like me who have to read through everything to really understand stuff, maybe read through it a couple times, stay put. First, Medicare Part A is a split up between a deductible, which allows you benefit period days. And this benefit period of days is 60 days after you've paid your Part A hospital deductible. Now for 2022, the hospital deductible is $1,556, and you pay that one time when you are admitted to the hospital. Now don't confuse this with going to the emergency room, because that is still under Part B until you are admitted and classified as an inpatient through hospital admission. Now this benefit period ends when 60 days have elapsed and you have no hospital stay or skilled nursing home care during a 60-day consecutive period. All right, keep that in mind. And let's go through the next 7 criteria that you have to meet in order to get qualified and get your skilled nursing home stay paid for, or at least covered under Medicare. Number 1, obviously, you need to have days left in your benefit period. Number 2, you must have at least 3 days of inpatient stay in the hospital that do not include observation days or outpatient services days. Number 3, you must go to the nursing home after the hospitalization in a relatively short time. Now, it's not given a direct or a exact date or a time days, but typically 30 days or less. Number 4, your care must require your doctor to prescribe you services that must be under professional personnel. So that means registered nurses, licensed vocational nurses, physical occupational speech therapist, and you must require these skills that your doctor orders for you. Number 5, skill is required on a daily basis. Now this doesn't mean 7 days a week, but it does mean at least 5 to 6 days you are requiring this type of skilled professional nursing care. Number 6, you must need these services that were needed for the medical condition that you stayed in the hospital for those 3 days for. Number 7, these skills and services that are prescribed to you by your doctor must be reasonable and necessary for the diagnosis or treatment of your eligible condition. I know. That was a lot. And unfortunately, we can only really tell the first 2, right? How many benefit days we have left and whether or not we stayed 3 days in the hospital. Well, unfortunately, the hole that Miss Leyanna fell into was one of the first 2. It was that she actually didn't have a 3-day stay. One of those days was classified as observation, which made her ineligible for Medicare Part A's nursing home coverage. So it's not that she was in the nursing home for a long time, it was that her entire nursing home stay was paid for by her. Well, how could she have known she was under observation? According to Toby Edelman, who is an attorney, senior advocate for CMS, Center for Medicaid Advocacy, quotes, "Unless people are in an observatory unit, the difference between observation and inpatient care is basically indistinguishable. So in 2017, a law was passed that forced hospitals to let Medicare beneficiaries know when they're in observation setting. This is called the Medicare Outpatient Observation Notice, or MOON. Not that kind of moon though, but that's what they were told to provide or furnish to their Medicare patient, and that the patient was to be disclosed and told of all the financial and potentially detrimental effects of being in outpatient observation status. Well, that's great, right? But unfortunately, the only time that the hospital is required to give you that notice is if you've been in observation for 24 hours. Then the hospital has 36 hours to provide you with this notice. To compound this problem, this notice could not be appealed. What that means is you couldn't contest the hospital with Medicare and tell them, why can't I just be admitted to the hospital? You had no say, nothing whatsoever. If the hospital deemed that what they were going to do for you, that's what was going to be done. To make matters worse, for folks who are either on a Medicare Advantage plan or original Medicare without a Medigap Plan G, N, or F, you're looking at paying the inpatient deductible along with 20% of all the services you received when you're in outpatient observation status. So all the MRIs, CT scans, therapy, doctor services are no longer covered under the inpatient Part A deductible. It is now being charged to you at 20% of the services charged. So due to this small hole, pretty large hole actually by now, she was charged the full cost of her skilled nursing home stay and used up her entire life savings. Now, fortunately for the rest of you folks, Medicare beneficiaries, the class action lawsuit is open. And with this, hopefully Medicare will amend or change their guidelines so that it's far easier for patients who deserve and who need to go into the skilled nursing home get it covered under Part A. Now, second, I know a lot of you say that, well, I looked at my Medicare Advantage plan and it says I have no copay for the first 20 days of admission. Sorry to burst your bubble, but if this is the first video you're seeing from me, you're probably going to be surprised at my take on this. But for those of you that watch me for a while, know that under Medicare Advantage, the big problem, you will need a prior authorization, which means that the hospital will have to ask the Medicare Advantage plan if they can send you to a skilled nursing home. And I've talked to many skilled nursing home staff, and as anecdotes will tell us, skilled nursing staff members will never join a Medicare Advantage plan because Medicare Advantage plans rarely ever pay for skilled nursing home care. And to add fuel to that fire, the second thing is this study from 2017, where it showed that the average stay for someone on a Medicare Advantage plan was 20 days in the skilled nursing home. Do you know how much or how many days someone on Medicare Part A got? 38. Almost double the amount of days that a patient received just because they were a member of the original Medicare program. And to kick Medicare Advantage one more time on the ground is that unfortunately Medicare Advantage doesn't treat post-acute care, which is like where you would end up after the hospital, very well under any circumstance when compared to original Medicare Part A. Now again, I will segue right here. Medicare Advantage is not perfect, but you need to work really hard to get the care you deserve. Under original Medicare Part A and B, it's a lot easier. Now, Medicare Advantage plans may be the only option for some people. And if that's the case, make sure you keep good records and also be really, I guess you could say, have a great working relationship with the medical staff and your physician, because they're the true advocates for you in the time of need. And they will do a lot more to help you if you do the most you can to help you get the best care. So I know I talk bad about Medicare Advantage a whole lot, but to be quite honest, it is necessary for some people and it does help a lot of people as well. But in comparisons, as you can see in most of the videos I produce, A lot of the Medicare Advantage members do get the short end of the stick when compared to those who stick with the original Medicare program and purchase a Medigap plan. But there's still one big elephant in the room, and that's, well, how do we pay for long-term care? Long-term care is super expensive. I know. I'm certified in long-term care planning, and unfortunately, long-term care planning is very expensive. There are solutions though. More recently, a product that I've just found called short-term care actually provides relatively affordable care and can stack right on top original Medicare Part A in order to provide you with a little bit more leeway so that you and your loved ones can really decide what you want to do for your post-acute care. Now, it does stack well with the Medicare Advantage, but I do need to probably shorten the amount of the deductible period days and potentially increase the benefit, because a lot of times the benefit, while yes, under original Medicare Part A there is a copay, usually my clients will have a Medigap plan to subsidize most of that. On the Medicare Advantage side, most plans will start charging you after day 20, so we'll have to build in a little bit of a buffer for that. But that's what we have to say. Medicare doesn't cover long-term care. I am sorry, but Part A does cover skilled nursing care if you follow the rules. So follow the rules, follow me for more tips on Medicare, retirement planning, finance, and I'll see you in the next video.